meaning by an aortic aneurysm.
Right now we are on pump, meaning that the heart-lung machine is
Completely still. This will allow us to open up the chambers of the heart and operate on the diseased valves within.
all around it, which protects the heart during the surgery while the heart is stopped. This patient has an arrhythmia called atrial fibrillation, which happens when there's abnormal electrical circuits inside the heart. This causes irregular heartbeats and a higher risk of a stroke. Part of our surgery is called the maze procedure. What we do is we create scar tissue in the heart that will interrupt these abnormal circuits of electricity to stop the atrial fibrillation.
We're using a cryoprobe to create pumping chambers of the heart, and this probe gets pretty cold. It gets down to minus 150 degrees Celsius. All right, we got a lot of work to do here. We're going to replace the aortic aneurysm with this Dacron graft. And this Dacron graft is woven polyester, and it's constructed as a tube. So instead of the patient having a large aortic aneurysm as a tube, they'll have this Dacron graft tube. The heart is a very efficient pump. It'll pump approximately 1 million barrels of blood. And in order for the heart to work efficiently, all the valves have to work in a correct fashion. For this particular patient, the valve closing is inefficient, which allows the blood to leak backwards in the heart, and this will eventually lead to heart failure if left untreated.
We have to operate on a part of the aorta that we cannot reach when there's blood going through the aorta. To do this, we have to stop the bypass machine, which we can only achieve by emptying the patient of all his blood. To be able to do this, we have to bring the patient's temperature, the brain metabolism, to drop down to minimum. So the faster we do this portion is going to be the best.
So I'm looking at the aortic valve here. You see 3 leaflets. As expected, they're overstretched from the aortic aneurysm. So what we're going to have to do is to reduce the length of the leaflets, the coronary arteries back on the Dacron graft, and then sew the 2 aortic grafts together. So I'd say the next hour is going to be a lot of sewing to get this back together. Before we've completed the repair, so we're giving a solution to help wake the heart up before we release the aortic cross clamp. Once we release the aortic cross clamp, a lot of times the heart isn't in a regular rhythm, so we have to shock the heart. So it's a lot like the CPR, but we're never really sure until we see how the valve functions in a physiologic state.